Right. Welcome to the African Alumni Association. This is the state of the nation. Of course, my name is Henry Sully, and before we start, we wish to acknowledge this land on which the University of Toronto African Alumni Association operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many indigenous people from across the Turtle Island, and we are grateful to have the opportunity to work on this land. Of course, once again, welcome to the state. Welcome to the African Alumni Association. This is the state of the nation, and we shall be starting in 1 second.
This is the state of the nation. Irifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Sully.
At the state of the nation, we are deliberate, we are reasonable, and we are uncensored. Of course, within reason. My name is Henry Sully. Today we are going to discuss about torture in Uganda. Specifically, we are going to interrogate or to examine the role of medical personnel in aiding torture in Uganda. Do they have a role? Some of you may be asking themselves. That is something that we are going to find out today. In 1987, Mr. Museveni was regarded as one of Africa's upcoming leaders, the beacon of hope, one who would completely eliminate the tortures of the past, many of which had been tied to Mr. Idi Amin Dada. He was seen as the new breed of leadership, African leadership that will take Africa to the 21st century prosperity and peace. Indeed, in 1987, using the Constitution, he created the Office of the Inspector General of Government, where people could go to report cases of human rights abuses as well as corruption. In a paper that was written in 1992, he was portrayed as someone, his government, his regime was portrayed as one that would eliminate all cases of torture and all other things that pertain to persecution of Ugandans. Mr. Museveni did not just fool Ugandans, he fooled international actors into believing him as a beacon of hope, not just for Uganda, but for East Africa and Africa at large. In the studio today, I have someone who has been a victim of persecution by the regime. I do have two medical personnel, one a doctor and the other one someone who has worked within the healthcare system of Uganda. They are going to give us their perspectives, and of course, we are also going to get the perspective of the torture victim. The torture victim that I'm talking about is Dr. Stella, of you audio of Stella. Dr. Stella, it's a pleasure having you at the State of the Nation today. Welcome. Right.
Thank you very much, Henry. It's wonderful to be with the State of the Nation this evening. I am delighted to sit with two medical doctors, clinical practitioners, people who have experience talking about the subject from the side of the professionals who swear an oath upon graduating to take care and do no harm. I enter this conversation as it introduced me as a person who categorically names Dictator Yoweri Museveni among those who use facilities of detention and the interrogation system of suspects, people who are suspected to be criminals, to torture, especially those of us who are in the opposition in Uganda. I come into this conversation as a woman because the narrative of women victims of torture in Uganda is not as loud as the narrative of younger male victims, although we know that age and generation are not discriminated in Uganda. I think that it's interesting that while many of the victims of torture whose bodies we have seen are men, they are also women in formal legitimate detention facilities such as the prisons and the police cells, but they're also people who are women that are incarcerated on islands, in basements, in cellars, in safe houses, in torture chambers, in Kalinabiri, that are unmarked and are unknown. And many of these women suffer diverse ranges of torture. I will be happy to talk about my experience and also to interrogate and debate and discuss with the medical professionals. Thank you for bringing us together.
Thanks again. It's always a pleasure to have you, as always. And we're looking forward to hearing more about what has transpired over the time that you have been persecuted. Next in line is Dr. Joel Milembe.
Thank you very much to the audience, of course, to the comrades, panelists. Special greetings, Dr. Sarah Nyans. It's a pleasure to share a platform with you, with all your accolades, titles, the wars you fought on behalf of the common person. Then my friend, James, nice to see you on this platform. And of course, Henry, who is hosting us and giving us space to express our views. Yeah, I'm here. I'm somewhere in Kabale. When network gets disturbed, it's a place with a very weird network connection. And when I knew about the platform, I moved with this. So I was able to change the bulb in the room so that platform people can see me. So now, my name is Mirembe Joel Majegere. That one is for activism. I'm a leader at Ugandan Medical Association, Kampala branch. I'm the secretary. I've been through the ranks of leadership, especially in the professional area. Of course, back then at university, guild, then the professional associations at university. And actually in 2018, when I became president for all medical interns, those are the doctors, nurses, and pharmacists, I formed Federation for Ugandan Medical Interns, the one which has been terrorizing Jaja Mwami and managed to scoop some 2.5 million as salary for these very hardworking doctors, nurses, and pharmacists. That was good. So I come on this show as a professional. I come as well as an advocate of health equity, where health is accessible, affordable, and the providers are independently providing it. Of course, I'm going to go into that as the show goes on. But I should not forget, I come from Bukunge village, Bukunge parish, because it's sub-county Mawokota. It's a Sabasajja, eri Mawokota.
Right. A pleasure having you here today. Excited to hear what you have to share with the world or the country at large. Next in line, Mr. Museveni. Pleasure having you to the State of the Nation. Welcome. Could you please introduce yourself?
Yes, thank you, Mr. Sally. I'm excited being here. Mr. Sally, this is just for, maybe I will say just for laughs. When I would call it an advert, when we threw an advert for this show on Facebook, somebody likened me to Stella Nyans, that the male version of Stella Nyans. Please, I'm not. I'm not the male version of Stella Nyans, because Stella Nyans is on the upper scale. But that said, I'm James William Museveni. I'm a medical clinic officer and a certified public manager. I trained as a certified public manager in USA, but by training, I'm a medical clinic officer, Ministry of Health from Uganda. I've been in Uganda for 51 years, and now I've lived in USA for 6 years. That makes me, I'm 58 years now. So the 51 years that I have lived in Uganda, I know that there is to engage in this debate, because I have been at community level as a service provider. So I know a lot. And through activism, I think I've ended up here.
Right.
Well, I'll pick up from there after I've listened from the rest of you, but trust me, I'll give you my best. Thank you.
We know you're going to give us your best, and we are excited to hear what you have to share. Dr. Stella Nyans, could you please share your this live on your page so that other people can get it? Because I'm getting some messages that some people can't get the show. Hopefully you have some time to do that. But I'm going to start with Dr. Mirembe. And I want to... Actually, let me start with a video of someone who has been tortured in hospital, or someone who has been tortured by security personnel. So after that, I would like to hear what Dr. Mirembe has to say and what should be the role of physicians or medical personnel in combating torture in Uganda, reporting it if you must, and pretty much educating the society within which we live on how to intersect or to interact with the security forces to minimize torture in Uganda.
Nzamukosha Diana is currently admitted at the Kanombe Military Hospital. At the age of 36, she had been selling clothes in Uganda since 2014. After 1 year of residing in the country, she was kidnapped by the Ugandan security operatives during the nighttime along with all her belongings. I was in my house sitting taking care of my child. It was around 8 p.m. and I saw people dressed in plain clothes entering my house and told me that there are security operatives and I should follow them to the police station. I asked them why they didn't come during the day. They said it's their right to come at any given time they want. As for my child, as soon as he noticed that they were carrying guns, he took off. Until now, I don't know where he is. They then took me to the CIM military barracks. I was badly bitten. Until now, I still feel dizziness in my head. When I arrived at the barracks, I kept asking them what I had done. They accused me of being a spy for Rwanda, and I told them that I was only a businesswoman, and I know nothing about spying. They kept torturing me in order for me to confess that Rwanda had sent me to spy. Until now, Nzamukosha Diana does not know where her 13-year-old child is. She calls on the government of Rwanda to help rescue other Rwandans she left in Uganda's detention facilities. She also requests for support because all her properties were confiscated.
hari abanyarwanda bene wacu ntabariza abasigayeyo.
Some Rwandans are still there. They need to be rescued because getting out of there is not easy. The reason I was able to get out was because as they came to take me, I had refused to get out of my house, and instead I yelled for help from the neighbors. When they saw everyone was watching, they decided not to kill me. Once they take you with no one to witness, they then kill you. Any Rwandan that would see my current situation wouldn't wish to go to Uganda. I don't know how I'm going to survive after this. I'm requesting the government of Rwanda for support.
Abari munasabaga leta y'u Rwanda ko yamfasha.
Zamukosha Diana is among 7 Rwandans that were dumped by Uganda authorities at Kagitumba Board this Wednesday. When she arrived, she was not able to walk due to the amount of torture that was inflicted upon her. She is currently receiving treatment at the Kanombe Military Hospital. Jane Mutoni reporting for RTV.
Right. Mr. Dr. Mirembe, I'm going to ask you to come in, and then after that, Dr. Sarah will come in. Of course, we have started with a lady who is of Rwandese descent, who ironically is in a military hospital, who was taken to the military hospital. The same forces that seem to have been party in torturing her. Her story sounds so similar to what Kakwenza Rukilabasaija recently narrated. The scenario where he was tortured and almost forced to confess that he was doing some spying for Rwanda. What are your thoughts regarding what is going on?
Yeah, Henry, thank you once again for hosting me. And the issue of torture in Uganda, it's unfortunate, is joining the list of evils that are getting normalized in our society by our government. But before I go into that, I want to speak as a doctor. During our training, we learn certain things that are values, principles that should never any of us deviate from. And when we deviate from them, they amount to halting your practice, medical practice legally, or actually scrapping away your right, your chance to practice any more medicine in Uganda and in the rest of the world. In fact, there are penalties where you are not even allowed to enroll in any other university. All these things are documented, there are laws everywhere. But I'll just mention if just for the basics. Henry, we are taught, and in fact, just not being taught, we should, and we always should practice some of these principles. For example, the World Medical Association, the Ugandan Medical Association, where I'm a member and a leader, we are signatories to pacts that don't support torture, and those policies clearly indicate how we are supposed to get involved in preventing torture. But for basics, before I go there, one of the principles we sign in our oath when we join the school and at the time of graduation is that do no harm. 2, be non-judgmental. 3, patient has autonomy. I mean, the patient should decide, especially when they are competent, adults, conscious, they should consent to everything. So when you look at what is written, the practice ideally, and what's happening in our country, it's very sad. You see, torture basically is inflicting severe pain, physically or psychologically, someone as a punishment or to persuade them, force them, do certain things you want them to do. You have heard the confessions from the torture victims, I must say I've also been a victim at some point. On the day when I nominated as MP in 2021, I was captured, taken in those funny vehicles, taken somewhere in Nassau, beaten, slapped until morning, and I was released. I was not charged, nothing. So up to today, I keep asking why. And the only reason why they told me was then I was encouraging youth, and myself I was putting on a red beret, assuming that was criminal anyway. I was not supposed to be tortured. I was supposed to be issued a arrest warrant, arrested, taken to court of law, or something like that. But now, going to back to still, Henry, doctors are not supposed, according to our values, our principles, and several World Medical Association declaration, Geneva, there is the torture declaration, which started actually around, was it World War? The Nazi German guys were doing a lot of torture and degrading things, cruel, inhuman practices on human beings. And they were using health workers to do this. So that came up to make sure that health workers are protected. We are supposed to work as independent, non-judgmental individuals. Henry, let me tell you, when I was an intern doctor at Mulago, they broke into my house 3 times. 2 times were politically motivated. 1 was normal thugs. But the most unfortunate part, one of the thugs who broke into my house, I could remember, because we grabbed the guy, took him to police, police released the guy, came when he has been beaten at Mulago Casualty. For care, I was there. Henry, I want to tell you, I had to put aside my pain. This guy almost caused death and injuries to my sister. She still has a scar. We treated the guy. He got well. Police came on 3rd day and he wanted to arrest him, but I don't know what happened after. But we treated him and he got well. That is how independent, how non-judgmental we are supposed to be as health workers. But now, I'm going to speak as a doctor. I'll speak as a person who knows as well the unfairness of the system where we work.
Yeah, before you proceed, in any other deliberation, can I also give Dr. Stella an opportunity to give us a perspective as well as a torture victim herself?
Right. So I have listened intently to what Dr. Mirembe has said. And I think that for me, I want to start on a tangent from what he said, that when he was defining torture, he said it's inflicting severe pain physically or psychologically as punishment, or to incite people to do what you want them to do. Now, in my own experience, I want to begin by criticizing military medical professionals, okay? And I will separate them from medical professionals per se who are working with civilian populations, right? And I want specifically to zero down on medical personnel, clinicians, psychologists, physicians, nurses, even cleaners who have to work in the prisons, in the police stations, in facilities of detention, in the military barracks, because those have a slightly differentiated category where they qualify to be military medical professionals. And the ethical questions that an everyday medical practitioner such as Dr. Mirembe is faced with may be different to people who are both military and medical. And I say this because I know that in Uganda, especially under dictator Yoweri Museveni, we're not operating under normal times. We are in a dictatorship where a military man is ordered and given an order. And some of the medical practitioners we have are first soldiers and then they are doctors. Okay. We also have civilians who have been recruited and they work in the prisons and the police facilities. But usually they're also civilian medical doctors who are working under a military regime where order ya jeshi ni moja. And in the circumstances of Uganda, where the military order from above, from Yoweri Museveni, from your best man Muhoozi, from Kataha, is an order which can lead to dismissal from jobs or promotion. Many times the soldier's ethic, his professional ethic, overrides the medical worker's professional ethic. And I want to say this in two regards. I was arrested for a poem in which I called Yoweri Museveni in Uganda, Matako Butako. And according to the CID investigating my case, they said only a mentally sick woman can write this about the president. And the prosecutors in my case applied to the courts to subject me to involuntary mental examination. When I was in Luzira Women Prison, 2 clinical psychologists came to the prison hospital and began an assessment without my consent, right? Without any, so issues around autonomy, issues around choice, issues around patient welfare, issues around what the patient chose as a specific treatment. Remember, the patient at this time was remanded in Luzira Women Prison, did not come into play at all. They immediately were operating under an order of the courts, which was illegitimate, an order also of the president's office to subject me to involuntary mental examination. And when we challenged this in court, they actually relied on an archaic colonial mental treatment act of the 1930s. And in this case, I was staring at 2 psychiatrists based at Butabika, the national, I think the referral hospital for mentally ill people. And they swear a particular oath, but it took resilience and an inborn rebellion and defiance to refuse participating in what I felt was a violation of my rights, even when I was a prisoner. Now, I'm a PhD person and I had access to legal aid and I could challenge these through a constitutional petition. However, most people had already written me off. So the first thing I want to say is that military medical ethics have often relied on the military as opposed to the medical ethical code. And so order ya jeshi in the order, and then they ask later on. The second sort of comeback to Dr. Mirembe is to say that when I was bitten, I was pregnant in, so the involuntary mental examination tried to occur in 2017. In 2018, I was bitten by prison wardresses. Dr. Mirembe said that torture often involves punishment. Many of the suspects who come back to us with torture evidence on their bodies are still suspects. Suspects who have not been proven to be guilty. But even if a person were a convicted, criminal, a convict on the death penalty, or a convict that's condemned for life imprisonment, I think that the question of the rights of detained Ugandans, especially those of us who are political prisoners, whether we are political detainees at the police stations or political prisoners in formal incarceration such as prison, or we are political detainees in unnamed illegal detention facilities such as CMI and SFC torture chambers. But the question for me, Henry, that's important, the question that's important is, as long as a person is a suspect, the torturers, the police, the medical officers working with the police have no right to begin a punishment regime. Which brings me to my third point, which I will stop at right now. the issue of torture during interrogation, torture that is facilitated by medical workers, where first of all, they assess our ability to endure torture. After assessing that one is fit, the temperature is fine, the high blood pressure rates are fine, then they give an approval that Stella Nyanzi can withstand sound torture. Stella Nyanzi can withstand intense light exposure. Stella Nyanzi may not withstand waterboarding because she has shortness of breath, okay? That medical workers who have sworn the medical oath are involved in approving the levels of torture and pain we can endure. So in Kakwenza's case, when he was exposed to sound, non-stop sound, night after night after night after night, when he was punished with decreased access to sleep, all those are psychological forms of torture that have been specifically diagnosed by a medical attendant, a medical clinical facilitator. And so my point is that enhanced torture of high-value political prisoners many times is approved by medical workers. And before we even talk about what they swear, the oaths they swear, I think that we have to look closely at medical workers who are working in security environments, because even when we are wounded, when our bodies are torn, they then come and participate in rehabilitating us, resuscitating us, measuring how much more we can endure. If we are still able to tolerate a bit more pain, okay, then they will come and continue the torture, the enhanced torture. But lastly, just to say, that's the fourth point around the involvement of medics in torture, is that when we have then endured the torture and we need to get evidence to take to court or Uganda Human Rights Commission, because some people have said, why don't the torture victims report? In my case, after I had suffered an abortion, a miscarriage in prison because I was tortured by prison wardresses, when I requested and I applied and I appealed, first through the clinic and then through the prison administration, and lastly through the courts of law, for my medical history, my medical records, okay, my prescriptions, my diagnosis, my prognosis, the medical military workers at Luzira Women Prison refused to give me access to this information, which I was going to use to make a case to give me access to private medical attention for post-abortion care, but also to use as evidence in court to bring my torturers to book. I reported them both to the lower grade Chief Magistrate's Court, as well as to Uganda Human Rights Commission. Now, my case has no evidence and it has stalled because the medical professionals who are involved in my post-abortion care denied me access to my medical records, and their action is supported by the laws of the prison services. Their action is supported by a specific branch of military medical ethics and regulations in Uganda. So I have tabled onto the discussion floor the question, is there a differentiated ethical code that medical workers who work with security are swearing? Because we might be criticizing them when actually they are soldiers before they are doctors. And we are calling them doctors, yet they're actually soldiers before they're doctors. Thank you very much, Henry.
Thank you so much, Dr. Stella, for outlining all those different facets of torture and expectations, medical expectations, regarding how we are supposed to evaluate this whole issue. Now, Doctor, before I call back Dr. Binet, I want to give James. I know James is probably the most experienced given his.
Henry, before that, I thought I could just make a few additions to Stella's submission before I continue with what I was speaking later after Mugeni. So Stella raises very important points, but just a quick one. There is no special medical ethical code of conduct for soldiers or anyone, all of us subscribe. In fact, I should use the word must subscribe and adhere to the same code of conduct. Most of the people become health workers, then soldiers. Of course, some the other way around. So the issue that I want to clearly put, based on Stella's submission, in our values, principles, and duties, and the responsibilities that physicians have to the patient, one of them is to have patient confidentiality and patient information. A client or the patient can request for their information anytime, and they should not seek any approval to get their own information, because before you treat the patient, you must make them understand what you're treating them. In fact, they are entitled to get reports, verbal or written, where necessary. Like Stella's case, she needed a report. So that was total violation of medical practice ethics. Stella has mentioned how the workers are used.
Yeah, before you delve so much into what Stella has mentioned, Dr. Mirembe, I want to give James an opportunity to speak.
All right.
Well, Dr. Stella Nyanzi's story is a sad story to listen to, but I think me, I'm used to the stories. I've listened to them. I've been part of them for a long time. But then there's something I want to tell Dr. Stella Nyanzi, or I want to tell to I want the world to know. Originally, we were deployed from hospitals. For example, if I was working in Mulago Hospital, I'm working with Mbarara University Hospital, on the duty roster, they would deploy a medic from the university or from the hospital to go and see people in prisons. There was time that we didn't have military doctors, military nurses, whatever. Militarization of medicine is a late development in the current status of things that we are dealing with. I personally attended to so many sick people in prisons, in military barracks, before this development. Some of them were our recommendations that it may be some people can be recruited to serve the medical people, the military people. But then it turned medicine into something else. Because I sometimes want to say that I don't believe that those fellas who are practicing medicine in the military facilities are medical people. They are not. They are not. There's a lot of camouflage that has taken place within the medics to have government achieve what it wants to do. I wanted to quote something from what I call the oath that all medics swear. And I'll just pick a few sentences from it. One of them is, I will prevent disease whenever I can, for prevention is preferable to cure. Then there's the other one that says, I'll remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, and as well as the infirm. And then finally it says, I do not if I do not violate this oath, may I enjoy life and art, respected while I live, and remembered with affection thereafter. This is what the doctors swear, or medics swear about. So we are discussing a very difficult thing. Me, I'm approaching it from private practice because I stopped practicing for government. Because of my speaking and talking, I could not hold any job with the government. But in my private practice also, I have had a lot of issues with medics my colleagues in government. With me, I have what we call, I have two forms. Torture victims approach me in my private clinic. I see them. Then I have this form to share with people in government, because government will not recognize anybody from private practice to stand in court for the tortured people. So I find a lot of pain usually if I have to get a medic practicing for government to sign this form. In most cases, they tell you, send the patient himself or herself. Send the patient himself or herself. Or sometimes they ask for exorbitant money and they even tell you, yes, I'll give you the stamp, because this form is supposed to be stamped that as evidence of torture. And then a medic will tell you, I'll stamp this form, but I'll never appear in court. So I'm trying to answer the role of medics. Much as we treat, I don't want us to ignore that one. The medics treat. But then also medics have a role that they need to play, which brings me here as an advocate. I want to do more of the advocate part of it, because we know there's torture. We have evidence of torture, but we have decided to keep quiet. I call it moral neutrality.
Right.
Yes.
Well, I guess I'm going to call back Dr. Milembe before you call back Dr. Stella. Dr. Milembe, you wanted to finish your submission regarding Stella's earlier submission. Please proceed with that, and also tell the world what, like, in regards to what James has said, should a medical personnel choose between serving the people and serving their interests as a human being? Because serving the people in some cases might mean that if you speak up, you're going to be fired from your job, or your contract is not going to be extended, or I know that you're probably facing a similar scenario where your contract has been terminated, or they have refused to extend your contract because of some of your thoughts as a doctor. What should be the line? Where should people draw the line, especially physicians who interact with the government, but also who have the obligation to treat people?
You know, Henry, we are currently living in a global village. And Uganda, surprisingly, is signatory to every declaration, let it be policy, that is international, and it's against torture of anyone, any human being, Ugandan or non-Ugandan. But also, it's important, before we discuss this, to appreciate the fact that where we are working from as doctors, it's not a normal world, especially in terms of authorities under which we operate. I want to just what actually you have just asked. Should the doctor act in the best interest of the patient, authorities, or their personal interests? The World Medical Association guidelines are clear. Number 2 of them, that the doctor or physician should act in the best interest of the patient in providing care. Like I said before, do no harm, be non-judgmental, and provide emergency care as on humanitarian grounds. Like I'm saying, what I'm trying to say, that if someone is dying, even when they don't have money, probably we should work on them. But 1, capitalistic society. 2, and extremely no system, no institutions working in this country. So now, going back to what I was supposed to say, I want to say categorically, because in 20, when they tortured Bobi Wine, I think it's me who read the Ugandan Medical Association statement, because then I was president of medical interns, how we condemned torture and how we offered ourselves as doctors to provide support to the torture victims, but as well, we called on doctors. Even this year, on 12th, this very month, we called on government, we called on health workers not to engage, not to support, not to aid any form of torture. In fact, the principles we follow, they are supposed to report anyone they see presented with any, because torture victims are obvious. Mentally, they are disturbed already. They have the marks of torture. Of course, themselves, sometimes when they're able anyway to talk, they talk. But look at what is happening in this country. At the torture of Bobi Wine, they brought him in Mulago. They wanted someone to rubber stamp a report they had made from somewhere. Everyone refused. They grabbed one colleague doctor, medical officer, took him in a room, told him to examine him. He refused. You can also testify if he's honest. So they grabbed this guy, took him and made him sign a report they have made for themselves from wherever they did make the report from. You get? So let me tell you, I have worked as an intern in government hospital. Recently, I was working with the SAID as a COVID response doctor, which contract has been terminated because of my participation in the recent doctors' strike. Okay? It has been terminated because of my speaking up. And the other reason they were giving, they thought I'm going to, working in their hospital, I'm going to report their evils. You get? So the government has got a clique of some health workers, but majority are not participating. Those who are participating either forced and the accomplices, like you can see, very many intelligent land people are supporting funny policies, funny regimes. I was supposed to speak as UMA, but now I also have got to speak for myself. I've got to speak for the people and the wider community I represent as an advocate of democracy. So this issue of torture is happening, and it is going to continue to happen, not because the health workers actually supporting it, but because the regime has created fear in anyone. If you don't sign it, if you don't do it, it is you who is finished. You are losing a job. The evidence is here. I'm not speaking from the blue. I'm a victim. So I have been told during that time, small time I've worked there, that you have no space in this ministry. You get? Because of my speaking that there are no drugs here, because of me saying that I'm not going to work because there are no things to support me to work, and several other things, because of taking leadership in a strike which was meant to make sure that supplies are in the hospital, health workers probably are paid well and all that. So where we are in a system that cannot allow honest men and women to thrive, to do the right things. That's the system where we are. It is pushing away everyone who is willing, who is going to speak the truth, everyone who is going to advocate for the right thing. All you have to say when you are inside that system is, thank you, yes, yes, yes. They bring you to Kakwenza tortured, they draft a report for you, and you're supposed to sign the report. I can tell you, if we can contact the one who signed Kakwenza's report, he is not him who wrote it. If he wrote it under duress. You get? Let me tell you, a good, true forensic report about Kakwenza would make people, everyone who read it, cry. Like you saw because as an expert, that report was too shallow. But I don't blame the one who signed the report, because I know, I have seen how people are forced to do such things. Mugenyi was talking about the medical reports. Yes, one, laws need to change, but of course, even if they change, as long as the head of the laws, the implementing system is still the same, it will not work. So change of law at this point will not work. We are all trained doctors. I have a license from Ugandan Medical and Dental Practitioners Council, but they will not allow you to sign that report, I assure you. You must be working for government. So in Uganda, there is a saying that says, "Manya, do not talk while eating. Here, don't Ismanya touch, Ismanya bite the hand that feeds you," and those other funny things. So because the situation is not people are hopeless, so people choose to say, "Monange, let me keep my job." I have been approached by senior colleagues, senior doctors, telling me now, "Where will you eat? Where will you work?" The system is not going to allow you to speak up and at the same time work. And I've already told them, but the money that we are paid is taxpayers' money. I pay tax. My father pays tax. Everyone pays tax, and that's why we're paid. That's not Museveni money. That's not the Prime Minister's money. It's not the PS, Minister of Health money. It's my money, in fact. So I have a right to work in the government and earn part of that money that personally I contribute and other Ugandans. But now, that's really a different story. When you look at the reports in Uganda, Human Rights Commission has reports of torture, and the reports are pinning Uganda police. Uganda police. They are pinning UPDF. They are pinning CMI. Masereka. When you look at those, I looked at Masereka in particular, and I'm like, oh God, what is this? But these things are not done by medics. These guys are too brutal, too ruthless, that they get themselves dressed in doctor, Nancy, medical lab attire. And they come, they torture you, they even pretend to be. Most of them are not doctors, they are quacks. Although UPDF and the police has recruited several health workers. But when they are doing these evil things, I tell you, they rarely take credible health workers, except those ones who have chosen and have declared that for them, they are part of them, which we know we cannot have 100% efficiency, even if we are to follow the principles that we are taught in school as doctors. So the issue is a system where people operate from. Because, as I finish, the law mandates me as a doctor working in the government, for example, if I were working there, to report torture to authorities. But where am I going to report? Yet, the people I'm supposed to report to are the very people forcing me to torture, forcing me to participate in treatment of torture victims, forcing me to sign false reports about torture victims. These are the same authorities where I'm supposed to go and report. So where do we report? Yet authorities committed these atrocities. So there is a president who said he cannot preside over a country where people disappear mysteriously, where people are detained without trial, where people are tortured. Where is that president? Has he spoken against the torture of Kakwenza? I last heard him say that he has an avenger. I don't know what that meant, but I'm sure the followers of this program and the panelists here know. So that's the challenge that we are having. The challenge is not about just the health workers. It's about the system where they work from. The few who agree to work with the system do it, but as doctors, as Ugandan Medical Profession, we condemn torture and any colleague participating in torture. If we had the resources and the capacity to identify such, I can tell you, Henry, I would follow up and make sure such people are dismissed. You get? Those would be the penalties for such. But we cannot have such errant members, the few errant members who are joining the clique of quacks that security agencies use. So that's the issue.
Dr. Milembe has shared a
Thank
lot
you.
of truth. When we come back, Dr. Stella Nyazi will respond to Dr. Milembe's submission.
This is the state of the nation. Irifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Sally.
Once again, welcome back to the State of the Nation. My name is Henry Sally. I want to thank each and every one of you who is following us on Facebook, Twitter, and YouTube. I also want to acknowledge people who have actually taken time to write some comments. Mr. Musaz Nelson Stewart, thank you so much for joining us. Miss Proscovia Nalukanga, thank you so much. Erica Bentley, John Ken, Silari, Teko Isaac, so many people. Ocheng Eliza Henry, and of course, Stand Up Uganda. There are so many people following us. Thank you so much for following the State of the Nation. Dr. Stella Nyazi, your response, Dr. To Dr. Milen.
Right, so I have responses to both previous speakers. I think I will start with, I'll start with two for Mirembe and then for Mangeni. So when Joel talks about Arua and the 33, I was the only Ugandan who got into my Toyota Ipsam, rode it to Arua, evacuated Shabana Tiku and Naita Sarah using the funds collected by many Ugandans. We fundraised and said, if the brutal regime of Yoweri Museveni is beating up Bobby Wine and the others comrades who are with him, the 33, we are going to raise funds and evacuate our wounded comrades. And I was able to drive them and take them to a private medical facility. And so while the story of Bobby Wine's brutal torture was widely spread, the stories of others such as Night Asara, a woman who was with him, and Shaban Atiku, a mere driver whose vertebrae discs, 3 of them were dislocated. He broke, fractured a tibia and a femur, his bones in his legs, and right up to today, many years later, Shaban Atiku has failed to get treatment. Why am I raising this issue? I'm raising this issue because the torture, blatant torture of suspects, right? Simply because of a political opinion that is different to the authoritarian regime of dictator Yoweri Museveni, has been documented. The case of Shabana Tiku, Naita Sarah, and the other 33 who were in Arua, okay, what happened to that case?
Yeah.
And so part of the questions I'm raising is that under the judicial system, the judiciary has been weaponized to become a trap for catching dissidents and opposition politicians, and then they are battered. Fake trumped up charges are opened about them, and then these sort of disappear within the judicial system. However, the wounding, the maiming, the broken bones, the brutality, the torture remains with these people. Shabana Tiku is a polygamous man who has, I think I met 2 or maybe 3 wives and very many children. He lost his income. He has been bound to a wheelchair, and because of the after effects of torture, he can no longer keep up his firm. And so these effects live on and on and on, even after the event of torture. And the story and the highlight is often put on the big charismatic leader, on Bobby Wine, on Chiza Besigye. But the other victims that fall in their shadows are many times forgotten, but there are very many of them. And that brings me to the second point, which was raised about, and it's an important one, that medical practitioners do treat, they offer care. And I think that point was made by Mangeni. It's important because even when we've been brutalized, and I want to relate this to those of us who are poisoned with slow-acting poisons during imprisonment. When I left Luzira Women Prison, I was not aware that in addition to a number of UTIs and anemia, that I was suffering with failing kidneys. About 1 month after my release from prison, I was admitted when I was foaming on the mouth to a private hospital, private public hospital, Mengo Hospital. When my prescription, when my diagnosis was made, the hospital immediately referred me and said, Stella, tetusobola nsonga yensonga yunzibu eri political. Okay. And they put me on a quick regimen of hospital and referred me to a specialized private care facility. Why? Is it because Mengo Hospital could not take care of me? Suddenly, when the diagnosis of failing kidneys was made and relation to toxins in my system was found, a month after I was released from hospital, armed men, police officers began to roam around Mengo Hospital. Although I was in a private ward, suddenly there was heavy presence of the police and military, and I had to be referred for onward treatment. I went home for about 3 days, and then my symptoms escalated and I had to go into private care, and I went to a private hospital. Now I'm raising this issue because again, the same diagnosis was made. There were toxins in my body. I needed to be evacuated, and the specialists who did a good job of giving me first aid, emergency care, said to me, for the sake of our practice, for the sake of our licenses and registration, we advise that you are evacuated out of the country because there are implications for our practice. We could be shut, we could be locked up, we could be, anything could happen. We could be penalized simply because we are highlighting that an ex-political prisoner was actually poisoned while in prison. And so what I'm trying to highlight is, yes, there are those who are treating and giving us care, medical professionals who have to work with the evidence of torture and experimentation. I don't know if mine was an experiment to see how much longer I would live, or indeed if it was real targeted murder. Why would you poison a convict or a suspect? But what I want to say is that therefore there are dire implications, and this underscores the third point which Joel raised, that for those who are treating us and working with us and providing evidence of torture and evidence of experimentation and evidence of being injected with substances that we never entered the prison or detention facilities or interrogation chambers with, those who give us that evidence many times are doing so at a risk, not of their medical licenses being taken away because they have breached professional standards, but because we live in a dictatorship which has its own ethics, which are unethical. And so it is risky. I think that Joel highlights the point about there are threats, we are tortured, we are harassed, we may be punished, we may be dismissed, we could also be suspended. This is not just hearsay, it is ongoing, and the threats are real. And so many comrades meaning they are part of the liberation struggle, but they're also medical professionals, decide to go into private practice. And as I've said, there are real dangers of private practice being closed down and medical doctors being denied their licenses. And the last point I wanted to make was in relation to evidence. And so my evidence of the miscarriage out of torture, my evidence of poison, Shaban Atiku's evidence of oh, I hear echo and feedback. So Shaban Atiku's evidence, Night Asara's evidence, and the evidence of very many others I will not name. Often when we go and our bodies are not named as political patients, we are not victims of torture, the medics, especially junior medics, are willing to offer this evidence. The minute we ask them to testify in court, to give evidence, then what Mangeni said happens. Suddenly they will say, hey, I can sign that thing, but let us get some other stamp, you know. These things are dangerous. And so what then happens is that, for example, in the case of Shaban Atiku and Night Asara, we got lawyer Rakafuzi before he had his unfortunate incidents with health, and he was willing to sue the torturers who maimed and broke the bodies of both Shaban Atiku and Night Asara. When we took the evidence to lawyer Rakafuzi, we were surprised there was alternative evidence. Dispelling this second, doctors have second opinions and third opinions and etc. opinions, that the first opinion that we received, which actually highlighted evidence of torture, was countered by second opinions and third opinions presented by the state prosecutors, showing a total opposite to the evidence that we received before these bodies were known to be involved in political contestation. And so suddenly it was our reports from the fake reports, right?
Right.
And what happens when medical doctors are presenting evidence that is contrary to the evidence of another, right? And I think for me, the last point about Uganda Human Rights Commission, just one thing I want to say, that as much as we have to call them to order and we have to highlight their failings, in my experience, because I have brought 2 cases before them, when I suffered the miscarriage because of torture in prison, they actually sent a mission to the Uganda Prison Services and then to Luzira Women Prison to take evidence. However, the prison authorities threatened prisoners. The prison authorities barred the medical staff. The prison authorities even demoted the nurses in the sick bay who received my fetus, my dead child out of my womb. And they were suspended for a period of about 4 months, the period during which the interrogations of Uganda Human Rights Commission were happening. And this was at the time of Medi Kagwa, before he died, the previous commissioner leading the Uganda Human Rights Commission. And so what I'm saying is that even when there is goodwill and political will and willingness of the Uganda Human Rights Commission and other mandated organizations, sometimes they are failed by the system. And so Joel's point about it being a systemic rot, it is not just the medical profession, it's almost the entirety of systems that work to support medical officers working with torture victims, such that Uganda Human Rights Commission may totally be captured. Uganda Prison Services may totally be captured. And so even the willingness ends up being sterile or barren because of the state capture that we live in as Uganda.
Right. Thank you so much, Dr. Stella. James, how do you, as a physician, medical personnel, how do you navigate the thin line between doing the right thing, but also ensuring that you do it safely, that it does not affect you as a person, it does not affect the bread that you put on your table?
Mr. Salimi, I lost almost all jobs. I lost a job with Mbarara University Hospital. I lost a job with Mulago Hospital. So it is difficult. Not until I had to settle. Okay, I last worked with the CDC, Center for Disease Control. By the way, who listened to my story and they were shocked. Now, when Stella Nyans talks about mental examination, I was examined also. I was taken for mental examination, and kudos to the doctor who made my report. Then he was still a good. He was a good doctor. The doctor. I mention his name because I don't fear, because I owe my living to him. He came up with a report where he said, "I'm highly intelligent." I don't know whether I'm it, but that's what he said. And then they said, "But if he's intelligent, we don't need him." And that's what they said. Now, there is what I call this the dreaded medical form. You know, a doctor will take you through all whatever this form needs, examining, seeing the story and whatever. But then there is this part that says name of the examining medical practitioner, title, qualification, telephone contact, and the physical address. You can sweat getting.
Oh, they want the physical address as well.
Yes.
So they can follow you up.
A doctor append his name on this. Sometimes if they dare, you'll find the patient parting with 2,500,000. I mean, me, I've been these things, I know it. It's painful. Right. Doctor will tell you, I will do it, I will sign it, but I'm not appearing. But then if I have to appear, pay for my risks. So they ask for that kind of money. So you'll find a patient moving with this form who's always looking for somebody to stamp, sign, and but people are not willing because they know the risk that are involved. I attended the court session with the doctor one time, and we were harassed by a lawyer, by a judge, whatever. Yes, the doctor was harassed, and he told me, "James, you know what? Let's wait for these guys in the hospitals also." That's how the doctor reasoned. Let's wait for these guys in the hospital also. But that said, also, I still have a very good experience. One time, I think there's somebody I served. I know he knows it. When I was working in the casualty department of Mulago Hospital, there's somebody I served who finally becomes a prime minister for this country, one of the prime ministers. He knows it. And my argument was, he's a patient. He's not a suspect. The point I'm trying to bring out from the medical side is that while you have those warring factions, for us, we pick patients. We don't pick a noob. We don't pick whatever. We pick patients. So when they're with us, they are patients. And that's how we navigate. We are treating a patient. We're not treating a suspect of anything. It's not a gunshot wound from whatever. It's a patient.
Right.
But what hurts me most, how to get the world to know the data. This data is not easy to come by. I'm reading for it data from General Katumba Wamala. This is a transport
officer.
Transport officer.
Minister, yeah.
Minister, yes. General Katumba Wamala read his report of last year that 3,633 people were killed in road accidents in Uganda last year. And then he goes ahead, says on Christmas Day, we lost 59 people, and over 190 were injured in road accidents. And then he's concerned, as Katumba Wamala, a general, that there is a connection between HIV/AIDS and the mortality rates in accidents. In that, it's taking the young people, 15 to 45 years. Recently, you saw Kulaija appearing on TV. Can Kulaija provide for us? I think you heard how he spoke. And then the spokesperson, Lieutenant somebody also appeared. You saw how they harassed people. So at the end of the day, General Katumba Wamala can easily give you a clean report. This report is generated from the hospitals, but you are not able to generate a report about torture, and yet every torture victim, I mean, if somebody is properly thumped or beaten, has to come to hospital. You have a broken limb. You have seen this boy with a shattered jaw. I think I think he was one of the victims of, I think, who suffered during the riots. The boy, an innocent boy with a shattered jaw.
Right.
That jaw requires,
November
requires
riots.
reconstructive surgery. Where does that boy go? And there are so many of that kind, but you almost can't classify. You can't, because the people who own this data,
Have conserved it.
Yes, this form is highly, highly sensitive. It's between the medics, which medics I don't believe are us. I don't believe, because if they are us, we are seeing Dr. Mirembe. Yes, these medics are not us. These are people in clinical or medical uniforms. Nobody can put on. You can even pick somebody from one day and give him a clinical uniform too, because those reports, like the one of Kakwenza, when I saw it, I remember when I saw Kakwenza's report, I made a comment that if I was still, when I was a clinical instructor in Bara University, I said I would take that guy back to school. What he wrote, like Dr. Miremba said, I think it's just something that was scripted for him to take this. So we have an issue where our final diagnosis in medicine, or if you are doing a post-mortem, you do it for the
Right.
That's how bad it is, that when you are doing a post-mortem, perhaps of anybody, I mean, you saw the fight between Onziva and who? Yes, Onziva, the pathologist Mulago, with his
Right.
Yes, that's how bad it is. Now they have generally taken over. These forms are no longer our issue. Very few medical people can consent. Very few medical people can want to give their addresses and telephone numbers. So you end up with torture victims who die silently because nobody can stand for them. But the other thing that I'm trying to emphasize as medics, maybe this is the start. I mean, medicine protects. I have a feeling there's one person who can even stop torture in Uganda, and that's the medical director of Mulago, because I know that's a man whom we can say almost starts Museveni's heart. Yes. There is no way Museveni can get referral to anywhere in this world without passing through Dr. Byarwaga of Mulago. But you wonder whether is Dr. Byarwaga having a job under quotes or he's a practicing medical director, because he can stop torture. And that's why I keep on insisting that medics can stop torture, because there is nobody in that country, Uganda, including President Museveni, who doesn't owe his life to God. The next person is a medic. The medic can say to start your heart or stop your heart. So those guys can listen to Byarwaga. If Byarwaga can talk to all of us, to all the medics. That's why I'm saying, I want to approach this issue from the advocacy point of view, because I know how bad it is. We are now having so many torture victims that torture should be almost at epidemic level. Because for that, maybe look at just this election alone. If you went to the internet, maybe Twitter, because Facebook doesn't even allow the young people to post those pictures. Go to Twitter and you see how dirty pictures that come from Uganda. On Facebook, it doesn't meet community standards. But on Twitter, there are horrible pictures there. Right. And if these pictures don't depict torture, I have heard people discussing this. Somebody even said that perhaps Kakwenza's daughter wrote on his back. Like, what?
Seriously?
Yes. The last discussion, which was spot on, the spokesperson said, how do we know that he didn't go to prison with those marks? But then where does one know it from? So it's terrible. It scares. But then, like I've said, as medics, I think if we come together, we can stop torture. Because if a medic will tell you, sleep in a mosquito net. A medic will tell you, use a condom. So what do we do for torture? That's a challenge I want all the medics to think about. What do we do for torture?
Dr. Mirembe mentioned that the Uganda Human Rights Commission has written various reports implicating the military and the police in all these torture events or circumstances. How do we implement some of the recommendations that have been suggested through the reports written by the Uganda Human Rights Commissions. Dr. Stell, notwithstanding the fact that Uganda is a dictatorship.
Right. So I think for me that I want to pick up on the point around advocacy that has been highlighted by both medical doctors. I think one through experience sitting on the Uganda Medical Association and the other through long-term advocacy. Every time I have been around the Twitter spaces discussing torture and Comrade Mangeni has been there. He has spoken out around, and speaking as a medical doctor, I think that the authority of having the profession behind him gives him credibility and power. And so what I want to do, first of all, is to call on a strategic organizing of the medical fraternity to join the lone voices, that if those of us in the opposition or the liberation struggle who are in the medical profession, be it a nurse, a midwife, whatever level, if we can amplify the issue based on we are medical professionals, this is our professional conduct, this is our contribution to the liberation struggle, we shall not participate in torture, we shall call out. And so to have a strategic political program, very consciously well thought out, such that when people are agitating for liberation, we know that the oppressor is going to beat us much more. If we think that the torture records have been high, they're going to get higher. I think the next 5 years, we're going to witness much more torture. And what I think is that we need to join hands and to amplify the voices of medical professionals who are already doing work, and whether they are targeting Uganda Human Rights Commission or the police and SFC and CMI and the other military and security installations, that they know there is a voice, a conscious voice calling out for an end to the participation of medical professionals in the torture of Ugandans. That's one. I think a very clear political and professional program. It is part of the liberation struggle. It is a front for doing non-violent work, but it is also a front for preparing the post-Museveni medical industry, because we need to clean up afterwards. And so one is a war, one is preparation of the public health system after Museveni leaves, that already we will identify comrades and allies involved in the liberation and the cleanup activity of Uganda. Secondly, I think that Uganda Human Rights Commission, as I said, is captive. It is captive. Just as the judiciary and the legislature, parliament and the military and the police and society have been captured. Uganda Human Rights Commission has been captured. Many of the appointments, very similar to the appointment of Dr. Byarugaba, are political appointments. Okay? Right. They are working for their stomachs, for their security, for their promotion, for the retrenchment of Yoweri Museveni in power. And so, one, we should call them out, but also I think that a day of reckoning is going to come if we have all the reports there. For example, in my case, I know that one day the hearing of the police, of the prison wardresses who tortured me and recreated my baby to die prematurely out of my womb, one day there will be a hearing. Okay? And why do I know this? Because the Uganda Human Rights Commission already have the evidence. I think that documentation, recording, keeping this evidence is important, such that when we have reclaimed Uganda Human Rights Commission and it's doing what it's doing, maybe all that we shall have in terms of attaining justice is recalling these files and naming our maimed and wounded people, and having a TRC, a Truth and Reconciliation committee of some form
Commission,
that
yeah.
will say Stella Nyanzi's baby was beaten. Uganda Human Rights Commission acknowledges that, and
Right.
nothing will bring back that baby, but there's a form of truth and reconciliation that's happening at that level to give us a sort of justice that is not about punishment or reprisal, but it's about retribution, because that is important for many victims. A friend of mine, Nana Mwafrika, was beaten by the police. She was pregnant, and how she lost her uterus during the beating by the police, right?
Oh my God.
Uganda Human Rights Commission are aware of her case. Uganda police, she sued Uganda police force. She won in court. She was compensated with a few 100,000 shillings. And Nana has asked the question, what does compensation mean in terms of justice? What does monetary compensation mean to Kakwenza? How much money, Pascal? Right? How much money for Dr. Chizavesije's fingers? How much money for Yasin Kauma's life? And so the right to life is the most important life. I think in terms of the Uganda Human Rights Commission, we are going to need to revise, to amend the provisions for compensation and retribution and justice of victims of torture, because currently they are almost an insult. How much money would be given to me for my baby that died in prison? How much? And so the idea of compensation for me is an insult. And I think that the Human Rights Act in Uganda, which talks about compensating victims of torture, is written from the perspective of those who have power, not from the perspective of those who are victims. And the last point is actually that in addition to the voices of medical professionals, we need the voices of victims to always come to the fore, such that we are speaking our stories, which are different and diverse. Not all of us are beaten and come out with scars. In fact, many of us are treated with steroids, which will disappear the physical tear and damage on our bodies. So we come out looking well, but the mental toil, the sleeplessness, anxiety, the men whose genitals were crushed don't have sex. They haven't had sex since they were released from Chitalia. Okay, and these are married men who have wives and have to keep their family names, etc., etc. And I think what I'm saying is that they have varied experiences of torture and how victims are trying to live their lives thereafter, which have to come to the fore. It is not always about he was beaten. Sometimes it was things done to his mind or her body, etc. And all these stories need to come to the fore, to the Uganda Human Rights Commission, because torture is not just physical or bodily, it's also all these other things. Thank you very much.
Thank you so much, Dr. Stella. Dr. Mirembe, I'm going to give you an opportunity to respond to both Mr. Mugeni and also Dr. Stella.
Thank you very much, Henry. I must say, I'm not necessarily making a response to the submission of senior comrade Stella Nyanzi or Mugeni, but rather I just want to put forward more comments on the same. Before I continue, I want to re-echo the commitment of the Ugandan Medical Association, which brings together over 7,000 doctors in this country, that we condemn in the highest, strongest term anyone who is part of us, who perpetrates or engages or who conceals information about torture victims, because these are clients, patients who have the same rights, should be managed using same principles. In fact, if principles are to differ, they are to be even baby treated, kind of, whereby they need the support of the health workers to make sure they get justice against the perpetrators of justice, whether government authorities, whether individuals, because we have seen torture by individuals. Henry, there are thousands, if not millions, of torture cases unreported in this country. When I was running for MP, the police got boys who were demonstrating against unfair treatment of our campaigns. They burnt their fingers, over 10 of them. They burnt them. Like, I had to start treating burns. These boys just organized demonstration, but when they were grabbed, put into cells, in the cells, without court, later they sent them to Chitalia, and
Right.
they were judged for a crime of spreading COVID. Yet the motive of grabbing them was something very different. So defines health as a state of well-being, mentally, psychologically, even financially, even, complete well-being, not just a state of absence of malaria, the disease, absence of TB or anything. So it is, the torture issue is being raised about our friends with the physical scars. But I can tell you, the health workers working in government facilities are tortured psychologically because of being forced into doing this. The common Uganda is tortured because the poverty is biting. I must say, I come from a village. I was raised from a village. I know what my people go through, at least those ones I interact with. So I want to argue, colleague doctors, nurses, and health workers, the system that forces us to do evil, wrong things against our conscious, ethical, professional practice. I know from history that during President Idi Amin Dada's time, hundreds of doctors fled this country to exile.
Right.
The reason was simple. They refused to compromise on their ethical code of conduct, yet they're working in government. Many of them were killed before they fled. Now, some of us, like the Mirembe you see here, we love this country so much. That's why I put on this Jazz of Uganda cranes. But then we are trained, we have the knowledge. Some people, where we pass, have already said we are intelligent. We pray we are. But we cannot give our people the professional knowledge to serve them. You see, let me also go to this. I come from Maokota South.
Right.
According to guidelines of National Development Plan 3, every constituency in this country is supposed, or county is supposed to have a health center for. We don't have one. In fact, even if I decided to go and serve my people for free, since now they chased me from the government hospital where I'd been given a job by a development partner, not even this government. You get? So I would choose, maybe let me go and serve my people for free. But look, there is no hospital or health center for where I can work with my skills. You get? So we are psychologically tortured. Then the physical torture that happens off camera. The few people get on camera, like my friend, Comrade Kakwenza, Comrade Stella, and several other people. So this is a joint problem that leaders in particular have got to address. The common people down there, I can tell you, will follow us if we choose as leaders to do the right thing. So now I'm speaking as an advocate that, you see, Comrade Stella is a member of the opposition. I'm a member of the National Unity Platform. I was active, very active during that time of election, the build up, people power and everything. But I can tell you, the leaders of opposition have got to man up, mature up, stop the infights. Many of them, someone said, opposition gye tusaba etuyambe kirabika nabo batukolamu musimbi naye kati waali mu field eyo
Right.
manyi oba statement eyo agirowoozaako mu byakola.
Right.
You get? So
Right.
let me tell you, Henry, we are hurt. Some of us are hurting. You get? I was assured of a job and income the next many months, terminated. So I have to go back and dig. You know, I raised my school fees with my mother through digging. So I
Farming,
either
yeah.
on business, which of course will be hunted, maybe, most likely. So the torture is everywhere on the face of Ugandans. I want to broaden the discussion actually to leave the direct scars that our brothers have to the broader picture. This torture wave is a reflection of what is happening in the entire Uganda, in the hearts of Ugandans. They are there worried of what is next. You talk to colleague doctors, colleague nurses, they say, Manange, ha, munange, my job. So it takes bravery, it takes sacrifice for some of us actually to come up. Power is gone, so bear with me.
Yeah, that's fine.
Yeah, it takes sacrifice for some of us to come up and speak up. Otherwise, we would be enjoying man life. We would be having, and all that stuff. But we have chosen a side of the people, and we are asking the senior colleagues like Dr. Seranyas, it's a time you colleagues man up. I don't know whether I can also use woman up. I'm having a
Yes.
poet on. She can
Yes.
also advise me on that. But me, as an individual, I'm not speaking for Nope. I'm speaking for myself. The leadership of the opposition is failing us to organize, because let me tell you, Stella has made very beautiful recommendations. They will never make any sense when a system that has power and sanctions the torture, sanctions the misuse of authority is in power. So what is the root cause? We must address the root cause of this torture that is all over the faces of Ugandans through sensible, honest, programmatic, corrective responsibility of leaders, those who purport to be our leaders in opposition.
Right. Thank you so much, Dr. Milembe.
I think this Mela starts to speak, right?
Fine.
Let me just make my last comment. What I had planned to make as my last comment.
Okay.
If I can get another chance, no problem.
You get another chance to close for the final remarks.
All right. Thank you very much, Henry.
Yeah, for the final remarks. So, Dr. Stella.
I have a feeling that that James has not spoken for a bit.
Actually, Doctor. Yeah, let me ask James to.
I'm a very fair person.
Yeah.
Oh.
Stella, they said that when people say that when a female Stella, a male Stella, we don't share things in common. I can't say what you say, but there's one thing I wanted to mention, and this goes to, Dr. Miremba has talked about, he had 7,000. Okay, in the association, there are about 7,000. That's a big resource. That's a big resource, and it's a starting point. And I'm not going to approach this from whatever. I just want us to look at torture as an epidemic. We mobilized the country against COVID-19. Unfortunately, this way again, I keep blaming our colleagues. I keep blaming my colleagues. Finally, President Museveni hijacked and started talking about his directives. These were WHO, CDC, Ministry of Health directives. How we lost it to him, maybe we are to blame. And that's what I'm saying now. We're talking about torture. I want us to give torture an epidemic approach. The same thing I'm advocating for, giving a public health approach to children in the Middle East, Saudi Arabia. Let's give torture at home, a public health approach. Let the medical world come up with how to prevent torture, because it's part of the oath. We rather prevent disease than cure, because it's easier to prevent. So how do you prevent torture? We know, because if Stella Nyanzi came to me and said she has an STD, I'll tell her, bring your partner. So if there is a victim of torture, and as medics, you know, my colleagues keep on saying that you're speaking from outside. I was in Uganda and I was speaking for 51 years. I got tired. I just wanted also to have a holiday, but I'm still speaking, and I now have better opportunities to speak from here. Right. But I'm saying, let's look at torture as an epidemic. And when you talk about article, I mean, this is in the oath. It says, I'll remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility as a medic includes these related problems. Right. If I'm to care adequately for the sick. So can we just also know that, yes, when we see a person who has come in as a torture victim, there are children, there's a mother, he's a father, and all these economic issues that we medics must be responsible for. So I'm saying we can address torture. We can blow torture to the whole world to know, because WHO is there, CDC is there, Global Health is there. All these, I mean, the other day I was challenging people who come here and keep on bring interviews. Have you interviewed the CDC? Have you interviewed WHO? Have you interviewed the Ministry of Health on torture? We don't have this. So let's give this a shout so that people can know that Uganda has torture as an epidemic. Thank you.
Thank you so much. And I think those your last comments, because we are going to be wrapping up in the next 9 minutes. So if you have final remarks, you can as well give them now. I think it's very important for us to reframe torture as an epidemic, as you have said. But also we need to challenge media, the traditional media, to speak more about torture in Uganda. I know these conversations have started on Twitter, and of course, some people have written about them in different platforms, but we need to challenge the traditional media, because they are the voice of the people. They are supposed to represent the common person. If they're not talking about these things in traditional media, let alone the State of the Nation and other courageous platforms who are talking about these issues, how are the people on the ground going to know that it's an epidemic? How are people, private entities also, how are they going to be able to create promotions to end torture in Uganda? James, do you want to give us your final remarks as we go around?
My final remarks, there is torture in Uganda. And my colleagues, we have one duty, to remember that we remain members of society with special obligations. This is the oath. I'm just picking from the oath. We are members of society with special obligations. Right. The obligations we have now to Uganda is to address torture. Me, I want to address torture. We must address torture as medics. Let's not take a back seat. All of us, whoever is beaten, will end up in hospital. Whereas the silent torture that we don't see. I mean, who knows what was going on in Stella Nyanzi's mind when she stripped? Do you know how big that torture is? That is psychological, that we don't see. We're only addressing physical torture that all of us see because somebody has. But think of Kakwenza's wife. Think of a child who has been told that perhaps they wrote on the back of their father. Right. The psychological torture is huge. By the way, up to now, I'm struggling with a medical student who was dismissed, who was fighting for social justice for students in Makerere. 26 years ago, Galogito Stephen was dismissed. And the man has lived with the torture until I discovered him recently through a social media post. And when you talk to him, you see that you're seeing a human being who has lived through torture. So the likes of Stella, I crown them because now, you know, when people say, come and see another Stella, a male Stella, I don't know what, because it takes courage to talk to be a Stella. But now if people think that now when I speak, I'm a Stella, and they try, maybe, you know what Stella does. Anyway, it takes courage to speak like Stella. So right. Stella, the women constituency is a big constituency also. You know, women in Uganda sometimes, because I've spoken to the youth. Stella, the other day, one of your youth lawyers is called Semakade. We need that level of activism, aggressiveness of young people. Me, I'm 58 years today and I'm still speaking. What about you, young person? And if I told you my journey, you can't, because it's a rough journey. I lost jobs, but you who doesn't have nothing, why don't you speak like we're speaking? So right. The women constituency is a big constituency. The youth constituency is a big constituency, and they are the ones who are in prison. For example, how many young people are in prison because of presidential directives of COVID-19? And the medics are quiet about this. These were not presidential directives, they are health workers' directives. Did we send anyone to prison? The answer is no. We did. Right. So that is my last comment. Thank you so much, Sally, for giving me the platform to advocate for stopping torture in Uganda. Thank you.
Thank you so much for all your thoughts. We appreciate your courage to speak out and to speak up. Dr. Meba, I'm going to give you that the opportunity to say your last word before I call in Stella to wrap it up. It's deliberate to make her the last person to wrap it up. So, Dr. Milembe, unmute yourself, please.
Thank you very much, Henry, for these last 1-2 minutes. I just want to re-echo information from the colleague panelists that the summary, the clear picture is, for Uganda, torture has become an epidemic. It is physical, it is psychological, it's in the pockets, it is in the communities of those who have failed to go back to school, the pregnant girls who still want school but they cannot go. Torture is being facilitated, fueled by lack of institutionalism in this country. It is being facilitated by those who are meant to prevent it. That is the president of this country, through the security apparatus and paramilitary groups. I want also to candidly call upon colleague doctors and all health workers. It is unethical and unprofessional, illegal to participate or perpetrate torture, to make and declare the gravity of torture in those forensic and police report forms. It is an offense, criminal. So because I want to say that, let me just re-echo the 4 basics of professional practice. One is justice and fairness. We must be fair to every patient, every client that comes in our hands. Because the next one is to do no harm. Don't kill, don't incapacitate, don't do anything to anyone with a deliberate intention to cause any harm, psychological, physical, on them, because those are the basics of our practice. Then there is a principle of beneficence. Do good everything, whether you're touching, even observing, whether injecting, whether writing that referral, because severally people are supposed to be referred because they are worried to be, politically tortured people may not go out of this country, not necessarily because the doctors there can't handle all, there are no private hospitals to handle, but because of the security. They are worried whether the security apparatus and the perpetrator of their torture will not send agents to cause more harm to them. So a patient, even if they just say, me, I want to be treated in the US, as long as it is on their own bill, even if in fact they just have malaria and they want to go and get that malaria treatment abroad, it is ethical right to write for them the referral. And the reason is patient request. You get? It is a
Right.
very strong reason that we normally use. But you see people have written reports saying, condition is in there is a point of autonomy. It's another principle. The patient who is of sound mind, adult, has all rights to decide the fate of their body, even when they are going to die and they say, leave me, don't touch them. So you forcefully treating patients that they heal faster, such that torture victims can be released to the general public, is illegal, unprofessional, unethical, and actually you are a candidate to be taken to courts of law. Unfortunately, here in Uganda, rarely do the courts of law work for justice. There is a principle of confidentiality.
That's the last one, right?
Yes. So these torture victims and all other patients need their privacy. These people who have managed torture victims just share their information anyhow. The only time when that can be broken is when there is a court order instructing you to give information to the case of a public concern issue. For example, there is a pandemic. For example, there is Ebola. There is, there is a state interest that is public on the health of the people, or someone maybe is a criminal. But what we are seeing, reports are being signed by unknown people. Several of these people, by the way, when you trace. Now, I want to see activists on the platform, and some are watching. Whenever you see that Dr. So-and-so signed, there is an online portal of Ugandan Medical and Dental Practitioners Council, where every registered doctor, when you punch in their names, you are able to know whether they are registered with the council or not. Because some of the people who have personally looked for them who signed these reports when they are nowhere to be seen. Okay? When they are not, the names are not anywhere. So that, of course, proves how mafia, state institutions, which we don't operate, and actually they want to make doctors look the problem, yet they are the problem who, one, impersonate in our names, two, coerce people into doing some of the things, three, most of
Can we
the
wrap
time
up?
they put on our gadgets, our uniforms, and they become us. For example, in the recent strike, some unknown people put on clinical coats and impersonated at Lila Regional Referral Hospital that they were doctors who were not participating in the strike, yet none of them were even a clinical officer. So, colleagues, Ugandans watching, if we want torture to end and things like torture, we must first institutionalize this country, Uganda, through credible leadership. Leadership eriwo kati at an individual level tetulina kirugenda kutuusa ne bwe tunawandiika policies 100 ne bwe tunawandiika amateeka ameka tegagenda kukola kubanga mu kooti abalamuzi yabalonda buli kimu so we must first track how get credible leadership, then we shall say bye-bye to torture. Thank you very much. For God and my country.
It's a pleasure.
Kabaganda.
Tukwebaza byonna byokola. We really appreciate your courage, and we pray that you do not get distressed given your employment circumstances at the moment. And we hope other organizations will have the courage to take you on. And hopefully the permanent secretary of Ministry of Health, Dr. She's a doctor, right? Dr. Jenna
Twine.
Oh, Twine. There, okay. Hopefully she doesn't interfere with any of your other contracts. Dr. Stella, you have heard from both men. I'm giving you the opportunity to close it as a lady and educate the nation.
Right. So thank you very much, ladies. Last, I celebrate my brother, twin, Dr. James William Mugenyi. I think I see your passion, and I see that passion in myself. I see your pain, and I see that pain in myself. A little bit about your experience, although you may have lived a little longer than I am, reflects a lot of my experience. Comrade Joel Mirembe has lost a job. I lost jobs. James lost jobs. So, Henry, you have congregated a panel of people who have suffered the wrath of Yoweri Museveni's dictatorship. The three of us are professionals, okay? We did not get to where we are by favor. It sounds that we have worked hard to attain our qualifications. And so the first thing I want to say that in dictatorship, since we're talking about the larger systemic issues, that very many of us who are professional, who have invested time in skilling and educating and professionalizing in professions that are really difficult, medicine, I have a PhD, you know, even the public management, the certified public management qualification, all those postgraduate qualifications take time and investment and resources. And it is painful that the dictatorship is totally watering down the value of professionals, right? I'm in exile. My father was in exile. James is in exile, or perhaps he migrated. Henry, you migrated. My brother Joel, you're welcome to join us. But the passion for Uganda means that we have to be very critical of brain drain. Okay?
Brain drain, yeah.
So this is my second point, that a military dictatorship is forcing medical professionals who still value ethics and still want to be integral to the oath they swore to leave Uganda. Medics, engineers, military people are, lecturers, Kakwenza, people are fleeing from Uganda, and that is not acceptable. That's my second point, that the brain drain has to be challenged, but it's coming from a place of the trickling down of the effects of living in a dictatorship. I want to touch on the point of the systemic torture, which Joel raises. That yes, we are focusing on physical and mental brutality in places of detention and interrogation, but it speaks to the wider systemic torture. The drones on the streets, the women looking for their children. Okay, so the torture that's happening in Mohose's SFC torture chamber is happening every day, in everyday lives. And that leads me to my fourth point in conclusion of the call for a public health approach to torture as an epidemic. This was James' point, that as professionals, as epidemiologists, as statisticians, as biomedical clinical pathologists, and people who can create this body of evidence, it is important that perhaps one way of engaging is to have a Ugandan professional's take on this epidemiology or epidemic of torture to generate the statistics, to generate the hard work, and then to have interventions at the professional level. My fifth point in conclusion is therefore in relation to the professionals who have studied biomedicine, the MBCHB, and all the other affiliated degrees, that we therefore need the front of activism and political politicking, the call for the leadership of the opposition to join. So the medics are doing their work, but you need activists and leadership of the opposition. Now, my brother Joel, when you say the leadership of the opposition is failing us, and you highlight my name, Stella Nyazi, I joined the struggle in 2016, right? I registered to be a member of FDC in 2017. So I'm a new entrant onto the scene of politics. What I want to propose is that we step away from our opposition political parties and we take up leadership roles, okay? We replace the seemingly impotent leaders. The revolution, the liberation struggle is now barren. Abasajja baliida abandibadde batuwakisa tebakyalina maanyi gatuwakisa. Tufune abalala batuwakise olubuto lwa revolution luzaale. In other words, what I'm saying is, if the leaders who are supposed to lead the political opposition parties are not playing their role, we don't have time to wait for them. What can you do? How are you doing it? Who are you recruiting? And maybe one of the ways we can contribute is to professionalize and have a sub-movement group of professionals interested in taking the torture angle as one of the other battlefronts we are supplementing, complementing the opposition political parties, because those leaders, you know, the issue that's happening right now. And finally, in conclusion, the point around challenging traditional media, I'm sorry, Henry, the traditional public media is also captured and compromised. There are reprisals, there are punishments, there are monetary fines. Media houses are being closed down. There are court cases. And so just as is happening with the medical profession and UHRC, Uganda Human Rights Commission, and the police, and all these institutions, the prison, even the public media has been captured and compromised. And so what do? We create our own media. We create our own platforms. If we cannot infiltrate what is existent, we have to create our own and forge a way forward. And maybe what we have done today is the way to go and to grow this, because this is combat. This is combat. They call us crazy because our methods are not the usual methods. This is a way of fighting. And I want to thank you very much for congregating us. My brother James William, if you need foot soldiers, me, I'm volunteering, but I'm not a medical professional and I don't have money, but I'm a woman who has passion and I am able to lend my time and my brain and my voice and my shamelessness to your struggle. And Mirembe, our eyes are on you. Ugandan Medical Association, our eyes are on you. We shall name you. We shall shame you. We shall remember who of you are signing those forms. And if indeed there's some medical professionals, tujabakwatanga revolution is when we are wearing our crowns, we shall name those doctors who are doing things to Kakwenza and Shabana Tiku and all the other comrades who've been tortured. Thank you very much, Henry.
Thank you so much for sharing everything that you have shared. I want to thank all of you for the courage to speak up, to come and speak up, to come and share your experiences. It is hard, and I hope the nation is appreciating your courage. I hope the world is looking closely and looking forward to engage with Ugandans to see how we can come together, not just to condemn, but to find mechanisms of stopping the scourge, the pandemic, or the endemic, as you have named it, the torture epidemic in Uganda. I hope other medical personnel are going to be as courageous as you have been. I hope other activists are going to join you, Dr. Stella, in this conversation, but also I hope we are going to have the courage to push beyond having conversations and devise means to stop torture in Uganda as we look forward to establishing new leadership within the country that we do love. I know most of us are living in the diaspora, 3 of us here at least, all in the diaspora now. But it does not change the fact that we are originally Ugandans, we are born Ugandans, and we shall always speak for Uganda and Ugandans. Again, for the people who have been following us on all our social media platforms, gwatugolera ku YouTube, subscribe, click the bell so that whenever we have these discussions. Those who are following us on Twitter, please follow and keep in touch with the conversations. Let us keep the conversation going. Of course, those who are following us on Facebook, thank you. We hope that you have gained some insights in this conversation, and we hope that you are going to keep us accountable as we engage in these conversations. I tend not to want to speak a lot, especially after the experts have interrogated the issue. I bring you the issues, I throw it in your faces so that you can engage and participate accordingly. Thank you so much, everyone is following, and thank you so much for engaging in this conversation.
This is the state of the nation. Irifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Sally.